Let's continue with our ethics discussion and look specifically at the ethics of controls and withholding treatment from our participants. So we've discussed subjecting a participant to something that is out of balance with the cost, but what about the cost of withholding a treatment? So by out of balance with the cost, I'm referring to the example of a new drug for male pattern baldness, for example. We're testing this new drug where there is reasonable concern that it could potentially cause death and blindness. Is it worth the benefit of potentially having thicker hair for participants? Is that worth the risk of death and blindness? Most people would say that it is not worth that particular risk. Therefore, we would say that they were out of balance. The cost was too great. But we haven't really talked about the cost of withholding a treatment. So in the male pattern baldness example, we're looking at the cost of if you do participate, what's going to happen to you? Is it going to be in balance? What I want to talk about right now is what about the cost of withholding a treatment? So we withhold treatments in experimental designs utilizing control groups. So in our quantitative modules, we'll break this down a little bit further, but a control group would be a group in our study who doesn't receive the treatment or the drug or the lesson or whatever it is that we're testing, so we can see what it would be like in comparison to someone who did. So kind of day as usual situation that we could compare with our manipulated situation, which is the one where we have used this drug or this treatment or this lesson plan or whatever it is that we're testing. So the considerations that we should make when we're deciding what's going to be the cost to the control group, the group of people that we're purposely withholding this treatment from. We talked about what would it be like if we use the treatment, what would be the cost to them, and is it worth the risk? But for our control group, what is the cost to them for not having the treatment? So what we want to consider is, do we have ample evidence of the effectiveness of the instrument? Do we have previous history, previous knowledge, previous studies that tell us that there is a strong possibility that this particular treatment is going to be effective? Of course, we want to look at what will the cost be to the participant. So how harsh would it be if we remove them from this particular study, or we remove them from the treatment group and put them in the control? How harsh would those effects potentially be? And how can these costs be offset upon completion of the study if we do decide to withhold the treatment for our control group? A control group, by definition, is always going to have the treatment withheld from them. So if we're using a control group in any kind of way, we want to look to these considerations. To expand on what this means and how we would handle this, I'm going to use the example of a classroom situation because that's where we see this often. We could also see it in medicine and other fields, but we're going to focus on a classroom situation for this example. In this example, let's assume that there is a new literacy program, so a new program that's supposed to help children, students learn how to read. We have seen some preliminary research, and the preliminary research says that there's a pretty decent shot that it would help with this particular group, but we're not entirely sure. We still need more research on this particular topic. So that is our first one. Do we have ample evidence of the effectiveness of the treatment? We don't. We have suspicions that it'll probably work based on prior research, but we don't have enough evidence in this particular situation to say that we're sure it'll work. Therefore, we feel that we need to justifiably do some research in this particular area, and that research is going to teach us something new about this. It's not going to tell us something that we already know. So it should be with a group that maybe it hasn't been studied with before. Maybe we've made some changes to it and we want to study it. So before I went into a school and decided that half of the school would get this treatment that helps their literacy scores and the other half of the school would be kept from these resources, they would not have access to these resources, I want to ask, is there ample evidence? So for that one, we're assuming that there's not a lot of studies out there. So we're assuming that there's not ample evidence, just our suspicions or our hypotheses that we think it'll work. What would be the cost to the participants? So the cost to the participants in this example, if it works, then our treatment group has higher literacy scores. If it doesn't work, or for our control group who's not using it, then they would just kind of be business as usual. They would have the same scores that they had had if we had not used this particular intervention. And how can we offset these costs once the study is completed? So let's say we do the study with this particular school and we find that those students that were in the literacy program did amazing, that this literacy program worked great for this school. Now we have evidence that it is a strong benefit to those students. Now that we have that evidence, so going back to the first question here, do we have ample evidence? Now we have ample evidence that's effective. So the next year, if I continue to withhold the treatment from that control group, now it's kind of unethical because I'm withholding something that I know will help these students without enough reason. There's no reason to say that, oh, well, it's keeping them, by doing this, we're going to add more to the research. We've already answered that question, so it's no longer ethically sound to withhold that treatment. What we would also do is share the treatment with everybody the following year so that those students, they didn't get it that first year when we were unsure if it worked, but now that we know that it works, that control group will receive that particular treatment and they will be able to get the same benefits that the treatment group did at that particular point in time. So these are a few of the things that we want to consider whenever we're withholding treatment. Mainly, we just want to be mindful of the idea that withholding treatment does also have an impact on the individuals that we're studying.